Hey guys, it's Savannah and welcome back to my channel. You're tuning in for another Wellness Wednesday, when we talk about keeping yourself healthy and well in the least toxic way possible. And today we're talking about something that's on everybody's mind, the flu. Flu season is really bad this year, with the flu shot expected to be about 10% effective. No one's counting on that. And it's well-known information. The flu absolutely sucks. Fever, chills, muscle aches, fatigue, the list goes on and on. And most of the symptoms are not fun at all. And because the flu shot is once again not really effective, people are turning to more natural ways to keep their immune system boosted, hoping that the virus will just pass them by. But what happens when that sore throat, shortness of breath, and stomach upset do hit you? Some people feel so awful that they rush out to the doctor seeking relief, only to most likely walk out of the office with a prescription for Tamiflu. And while they're just hoping to feel better and get back to their lives, many people unfortunately get more than they bargained for. Today, we're going to be talking about the safety between just letting the flu run its course and interfering with Tamiflu. So, what exactly is Tamiflu? In 1999, Tamiflu received FDA approval in the treatment for both influenza type A and B, after safety testing on approximately 1,300 adults with suspected flu. None of them were actually swab tested and diagnosed with confirmed flu. This test determined Tamiflu to be reasonable for the intended indication and population, and the reduction of symptoms was about 1 day. While both influenza type A and B remain the most common culprits for the seasonal flu epidemics, during the trial approval of this drug, only about 3% of the population were actually confirmed to have suffered from influenza type B. The approval evaluation actually recognized that once an individual contracts infection and develops influenza symptoms, the role of the antiviral remains limited. One of the main reasons that the flu is actually really difficult to treat is because it's a self-limited illness. This simply means that it resolves spontaneously and without any real specific treatment. At the end of the evaluation for Tamiflu, Dr. Heidi Jolson actually noted that clinically the treatment benefit is a highly subjective question. Because influenza symptoms are self-limited in a majority of individuals, it is anticipated that many persons with influenza will neither require nor desire treatment with antiviral medications. And despite its approval, the FDA actually did conclude that the drug has not been proven to have a positive impact on the potential consequences, such as hospitalizations, mortality, or economic impact of seasonal, avian, or pandemic influenza. Simply meaning that the drug actually hasn't even been proven to work. An interesting fact to actually note about this drug is that all clinical studies and randomized trials that exist on paper were actually funded and sponsored by Roche, the manufacturer of the product itself. The BMJ, one of the world's oldest general medical journals, has identified 83 trials on Tamiflu use in both adults and children. And less than half adequately reported random sequence generation or adequate blinding of the participants or staff. It was determined that these studies carried a high risk of bias, presented unresolved discrepancy, and even contained design errors. While this involvement could have no relation to the outcome of the studies, Roche does have a questionable history. In 2012, the European Medicines Agency launched an investigation into Roche for failure to comply with obligations regarding detection, assessment, understanding, and prevention of adverse effects or any other medicine-related problem. The BMJ, in a campaign to achieve necessary, independent scrutiny of data from clinical trials, curiously noted that despite the fact they've never vetted the Tamiflu data, the WHO, EDC, and CDC recommend and even encourage the use of Tamiflu. This is also despite the fact that the majority of Roche's Phase 3 or human trials in larger numbers trials remain unpublished even years after completion. In fact, in 2009, Roche publicly promised access to full study reports for select independent scientists, and to this day has yet to make even one report available. So despite the fact that Roche is a very questionable agency, does Tamiflu even work at all? Honestly, the answer to that question seems to vary from person to person and their definition of the word work. 20 studies on the drug have found it to shorten the duration of influenza-like symptoms by less than a day. As noted by the FDA during the approval process, Tamiflu studies continue to show that the drug does not affect one's risk of needing hospitalization, nor has it been able to reliably report reduction of other complications like pneumonia, bronchitis, ear infections, or sinusitis. And as with all medications, Tamiflu does come with a list of potential side effects. The most commonly reported were headache, nausea, vomiting, bronchitis, insomnia, vertigo, and all of these oddly sound like the flu. When it comes to the viral shedding and spreading of the flu, studies have shown that Tamiflu doesn't even reduce the length of time that one is contagious, or even the likelihood that it will pass on to household members. On their website, Roche recommends the use of Tamiflu even as a preventative for those who have been exposed to the flu. Yet the evidence to support this suggestion is, to say the least, lacking. 4 studies on the use of Tamiflu as a preventative exist. 2 of these trials show efficacy rates of 58% and 84%. Only one of these trials was ever deemed adequate by the usual Cochrane collaboration, as others were deemed at risk of bias and didn't properly describe their methods. In an attempt to deal with the shortcomings of the study, Roche Pharmaceuticals failed to provide original data or any information at all. Fiona Godley, editor-in-chief of the BMJ, reminds consumers and taxpayers that approximately 60% of patient data from Roche's phase 3 treatment trials remain unpublished, and that at this point there is a high chance of overstating of effectiveness and the apparent underreporting of potentially serious adverse effects. So what are these serious adverse effects? Because Tamiflu has been prescribed in Japan much more extensively than in the rest of Europe or the United States, reports of psychiatric side effects are much more likely to come from there. While the cause of these types of side effects is not really understood at all, some theories suggest that Tamiflu actually has the ability to cross the blood-brain barrier into the central nervous system. One study on mice found high concentrations of a substance created when the body processes Tamiflu. And this was located in the brains and plasma of young mice, which indicates that children are most at risk of developing reactions to the drug. One interesting case of psychiatric side effects caused by Tamiflu can be seen in the study of an otherwise healthy 22-year-old male who began reporting mood swings, suicidal impulses, auditory hallucinations, memory deterioration, and insomnia, which were brought on suddenly and randomly 5 days after starting Tamiflu. Upon admission to the hospital, the patient's mood was severely unstable and he reported auditory hallucinations of a phone conversation between a man and a woman. He was also unable to sleep more than 2 to 3 hours in a 24-hour period, and due to memory deterioration, forgot what he had done even hours prior. The patient was actually admitted to the hospital on the suspicion of bipolar disorder and delirium, and he was actually treated with antipsychotic medications. By day 3 of his admission, his mood and behavior actually seemed normal, and the symptoms such as suicidal thoughts, hallucinations, and memory deterioration had improved. Given his rapid improvement, antipsychotic medications were ceased. By day 8 of observation, the patient revealed no specific psychiatric symptoms and was discharged with the diagnosis of mental and behavioral disorder due to the use of other psychoactive substances. At his 10-month follow-up, it was noted that the patient had returned to his normal life and no longer suffered psychiatric symptoms. And the scary thing is, that's not the only story like it. In fact, in 2006, the FDA issued a neuropsychiatric events warning, stating that people with the flu, particularly children, may be at an increased risk of self-injury and confusion shortly after taking Tamiflu and should be closely monitored for signs of unusual behavior. As recent as 2011, in an FDA pediatric post-market adverse event review, it was determined that the results do not go so far as to show that there is a significant positive correlation between the use of Tamiflu and abnormal behavior, but that they do not directly indicate that there is no relationship between the use of Tamiflu and abnormal behavior. And Tamiflu scrutiny really flared in 2005 when 12 Japanese children died after taking the drug. 2 years later, in 2007, Japan actually made the decision to ban the use of Tamiflu in pediatric populations, and this decision is still upheld today. Cases of adverse psychiatric effects continue to be reported, yet its use is just being increased in the United States. A study of about 10,000 flu patients by the Health and Labor Welfare Ministry found that teens who took Tamiflu were at a 1.54 higher risk of abnormal behavior such as sudden running or jumping. In fact, at least half the children who take Tamiflu will suffer some sort of adverse reaction, most commonly nausea, nightmares, and difficulty concentrating. It is imperative to weigh these potential dangers against the possible reduction of the symptoms by only up to a day. While the flu is unquestionably uncomfortable, a magical cure-all pill isn't really worth additional suffering. So what should you do instead? Incredible natural remedies against the flu have long been used before the release of synthetic antivirals like Tamiflu. Elderberry has been scientifically documented for years because of its ability to shorten the duration of the flu and help relieve the symptoms. Randomized studies which compared the use of elderberry versus a placebo found elderberry syrup to reduce the length of the flu by up to 4 days. The reason for this is because of sambucol, or black elderberry extracts. These contain natural antiviral properties, which are particularly effective against different strains of the influenza virus. Ingesting high levels of vitamin C also naturally increases the body's production of white blood cells. One study compared individuals with cold and flu symptoms who were consuming high doses of vitamin C, or about 1,000 milligrams, with a control group who were treating with pain relievers and decongestants. By the end of the study, it was determined that the vitamin C alone was responsible for reducing the test group symptoms by up to 85%. And the last suggestion I have is oregano oil. The incredible benefits that come along with the ingestion of oregano oil are barely being explored in the Western world. But studies are showing some promising results. Carvacrol, the active component in oil of oregano, has shown impressive antiviral abilities within just 1 hour of exposure. Carvacrol's antiviral properties have even been put to the test and exceeded expectations in treating drug-resistant viruses like herpes. The flu, it leaves you exhausted, in pain, and feeling downright awful. At the time, it could be extremely alluring to simply pop a pill that promises to make you feel better. But it's really important to stop and remember that getting sick is just part of life. It happens, and in the majority of cases, aiding your body in doing its job, which is to fight, by supplementing, staying hydrated, and resting are the best things you can do. When you're sick, it's hard to wait to get over it. But at what cost is it worth speeding it up?